Hi, so it is my pleasure to present some of the results that we presented at last UASCO in 2021 about the OSPREY study that was conducted prospectively. This is a phase 2 and 3 study that looked at the accuracy of the PSMA targeting agent DCFPyL in patients with prostate cancer. There were 2 cohorts in this study. Cohort A was for newly diagnosed high-risk prostate cancer for staging, and cohort B was for recurrent prostate cancer and metastatic prostate cancer. And here we presented a study where the upstaging of the stage of M1 and M0 prostate cancer was looked at. So in this study, 117 patients with radiologic evidence of local recurrence or metastatic disease by conventional imaging were imaged by DCFPyL and looked at. And we had a total of 82 patients that had baseline M1 disease by conventional imaging and 33 that had M0 disease by conventional imaging. And interestingly, what was shown here is that the DCFPyL PSMA PET-CT upstaged up to 58% from M0 to M1. And for those who underwent percutaneous biopsy, 10 out of 11 finally had confirmed M1 disease. We also looked at the patient that had M1 disease, but that were upstaged by the DCFPyL. So in fact, of the 82 patients that had baseline M1 disease, 16% of these were upstaged. There were 10 out of 64 that were upstaged from M1A to M1B or C. And there were also some patients that were downstaged in 22% of cases from M1 to M0. So this shows, again, that the DCFPyL PSMA PET-CT can really change the staging of prostate cancer, even though that patient is known to be metastatic. The other important conclusion of this study is that a majority of patients with M0 progressing prostate cancer can be restaged to M1 disease by DCFPyL. So the clinical correlates and importance of these findings will need to be determined by future studies.